So good day, good morning. I always try to be safe with Washington in that we're in New Jersey, so our time frame's a little different. So I play it safe by saying good day, but I assume it's still morning in Washington. So good morning to you all, and welcome to the Golden Thread of Foundational Community Sports session 2. I am going to be facilitating today's presentation. I'm joined by my colleague Emily Bands, and we really look forward to an engaging session, and this is certainly a priority session. Not that the others aren't, but this is certainly one that is really focused on a mainstay, a significant element of the whole process of providing services and ensuring that those services are aligned with the standards and best practices associated with FCS. So today's subject matter is the assessment process and prioritizing areas of need. So I want to quickly get into it, and we'll do some housekeeping, and then we'll get into the meat of things. So welcome. Today's webinar is hosted by DBHR through the Washington State Healthcare Authority. And as I mentioned earlier, this is an interactive training, and we look forward to your interaction. We will ensure that we facilitate as much discussion and sharing of information as possible. The slides, as well as the link to the recording of this webinar, will be sent to you by email after the presentation. I just added the presentation, the PDF of the presentation, to the chat, and you certainly can use that to follow along with the training. So for our housekeeping, as I mentioned earlier, I also put the call-in information in the chat in the event that you're having difficulties with your audio and video. I ask that you keep your self muted to keep down background noise unless you're speaking directly as part of the training, and we reserve the right to certainly mute you if that becomes a challenge. You can choose to have your video on or off, but certainly if you do have it on, be expected you'll have that professional appearance that I know is standard here. To ask questions, you can use the chat or simply unmute, and we're happy to have your engagement today. Please be reminded that this presentation is recorded, and the presentation will be sent to you at a later time. So that's our housekeeping. Hopefully we're able to kind of get through things today without much challenge. So as you know, this is a 6 consecutive weeks training series that really takes us through the journey of the whole process of the provision of foundational community supports. We certainly had our first session last week, and we spoke about introduction to the Golden Thread and psychiatric rehabilitation. Today, we're going to step into the assessment process and prioritizing areas of need. We'll have certainly 4 other sessions that really takes us through the journey, like I said, from engagement through to documentation and service delivery, or service delivery and documentation subsequently. All these trainings are going to be held at the same time on Mondays, and the link is certainly viable for each training, so you don't have to get a different link. As I mentioned before, my name is Earl Leach. I'm a senior trainer and consultation specialist with the Department of Psychiatric Rehab and Counseling Professions here at Rutgers Schools of Health Professions. My colleague Emily Bands has joined us. She is also part of our team here at Rutgers that are contracted to provide these training sessions and services for Washington State Healthcare Authority. And we're happy to be part of this engagement with you. And we always have a really fun time and a great learning engagement with you. So we look forward to that today. So I want to do a review of session 1. In session 1, we really looked at the Golden Thread and psychiatric rehabilitations. We really took a look at how the engagement progressed from that initial meeting and greeting and developing that trusting relationship through the process of assessment, goal development, the provision of intentional services, and documentation as a finality or conclusion of that entire process. So we really looked at how the golden thread, how those elements of the entire service process is linked, and how that particular link, that golden thread, really lays out an illustration and a picture of the entire journey that the client engages in when they are in receipt of services. So that's essentially what we looked at in terms of the overview, and really looked at how we will take the step-by-step process of learning the skills, knowledge, and resources necessary to ensure that we're doing all of those elements in the most efficient, effective ways, and with best practice and adherence to the philosophy that drives the service. So we'll do a quick review. And I will ask that I'll put up a poll for you to provide us with some feedback to that question in terms of the review of the learning application from week 1. So I'm going to launch the poll, and I would ask if you can provide some feedback to give me a sense as to how things went with the learning application from week 1. So take a few minutes and provide some feedback as best as you can. And Nancy, the link to last week's training is in the chat. So if you go in the earlier part of the chat, you will see it. If not, let me know, and I'll simply ask Emily to put it in the chat again. And thank you all for joining us. Catherine, welcome. So let's take a look at the poll and get a sense as to how things went with your learning application for last week. So the first question is, did you attend session 1? More than 3/4 of you, 84% of you said yes. So there's a few people who this is their first session, and welcome, and we hope that you will certainly be able to catch up and join us. The information from session 1 is also available to you. Over the past week, did you speak with a client or anyone else about their valued life roles? So just about half of you said you haven't done it as yet. About a third of you said yes, you did it with a client. Certainly, I'm glad that you took the opportunity to put that learning application into practice. It's the best way in terms of how we enhance our efficacy and our effectiveness at providing the service, in terms of that kind of learning theoretical frame of reference we take into the practice mode in the real environment that we work in every day, and give it a shot and see how that has worked. So I'm glad to hear that people have done that. So delighted. So for session 1's review, we looked at goal-directed services. All services are driven by client goals. So we spoke about that at length, and we talked about the importance of the medical necessity. So really ascertaining whether or not that person meets the risks and the needs that are clearly defined as medical necessities for the services, in order for them to really to engage in the services that is expected to meet their needs, because they meet that criteria. So we'll talk about that some more quickly. We talked about medical requirements for FCS, and we talk about how you establish that prior authorization from establishing the medical necessity for the services. And we looked at also auditing and the post-service audits as part of that process. We certainly look at best practices for psychiatric rehabilitation. We spoke about that at length, and how those goals drive services. Really looking at focusing on supporting recovery, community integration, quality of life. Those are the three standard goals of psychiatric rehabilitation. And in terms of best practices, we're trying our very best to adhere to those concepts and ensuring that our service and engagement are really focused on meeting those specific goals for psychiatric rehabilitation. Supporting recovery, community integration, and quality of life. We also certainly want to focus on the individualized and person-focused and this collaborative efforts in terms of our engagement with our clients or consumers, and really ensuring that we're honing in on treating that person as an individual, looking at that person's skill set, that person's resilience, that person's sense of who they are and how they see themselves in the world, how they operate in the world, and ensure that our services and practices align with those concepts, with those principles, with those values, with that vision that is aligned with the consumer's vision. And we certainly spoke about how motivation comes from valued life roles, where the concept of people tend to put most of their energy and resources to those concerns and matters that are important and integral to their daily life and their sense of who they are as a person, who they are in the world, and how they want to be seen in the world. That concept of those valued life roles. Good example is really focusing on ascertaining from that person, what are their valued life roles? A good example would be someone who sees themselves as, I want to be a good dad. I want to be a good citizen. And really seeing how their goal creation and the goal formulation is around knowledge, skills, and resources that would enable them to function in those roles. So I'm hoping that that really gives you a scope and a memory of what we discussed at length in the first week. So those were certainly the review concepts. So in terms of the valued life roles practices, we know a lot of folks said they certainly have not attempted to do so yet. But the question is, for those who really attempted to engage in discussions with their consumers around valued life roles, the question is, did anyone disclose any unexpected valued life roles to you that really startled you, or really you were taken aback by, or you didn't think of, or you weren't considering when you were posing the questions about what is that person's valued life roles? Were you surprised by any feedback from a consumer once you were engaging in that discussion around valued life roles? And if not, that's fine. In some instances, you know, once we've been in this field for a while, we've seen it all, so nothing really surprises us. But certainly if there's one that really took you by surprise, I'd certainly like to know. Great, David said not really, it went well, but not unexpected. Indeed. Well, that speaks to the nature of what we do oftentimes. It is not easy for us to be surprised. So what was challenging, you know, what did you learn by asking that question? Was there anything that you learned specifically that came from that interaction, or was kind of shocking to you? Just think about that for a moment. While we get right into the learning applications for today. So the whole takeaway we hope you gain from today's engagement and interaction is certainly related to identifying the key components of the assessment process. Identifying assessment best practices. And applying the 8 dimensions of wellness to identify strengths and needs. Those are our objectives for today's session. That's the takeaway we want you to get after engagement in today's session. And we will check in with you to ensure that we're moving in that direction. So what's the assessment in terms of the golden thread in FCS? When we speak to the assessment process, we're really speaking to how do we determine, how do we establish medical necessity? How does that person, based on what we know about that person, the information gathered throughout our initial intake process, how do we use that information to discern whether or not that person meets the criteria for service acceptance, for service engagement? And we look at assessing the strengths and needs. And I'll go back quickly. Mariella said one had a hard time speaking about themselves. I was surprised as to how many he had, and then he was able to focus on one and has to do so with his medical treatment. Great. I'm glad to hear that, Mariella. Thank you for sharing. But oftentimes we find that sometimes it's difficult to get that conversation rolling, but once we get that person to that level of comfort with us, the rest flows. So in terms of the assessment in the golden thread of FCS, we really speak to the really medical necessity and assessing strengths, and that information, that collection of information and data really helps drive the identified personal goals. It really lends us the bridge to which we can then look at that person and work collaboratively with that person around really identifying goals that are prominent, that are important to them, and goals that they are committed to working on, they're motivated around. So that's basically the framework in terms of looking at assessments from a golden thread standpoint, how we see that link and connection through the entire process. So I want to ask you very quickly, first, to get a sense as to how we're going to be able to proceed along the way in terms of how much information and to whom that information is going to be vital. I want to ask you the question of what's your role in FCS in terms of assessment? What role do you play in the assessment process? And I'm going to once again share a poll for you to provide me with some feedback. So if you can take a moment and provide some feedback in the poll as to what's really your role in the assessment process in foundational community supports. All right, let's take a look. So the first question is, do you complete foundational community supports assessment? Just about a quarter of you say the AmeriGroup assessment only. A number of folks also said comprehensive assessment, and about 18% of you said both assessments. So there seem to be a larger majority of you that really do either both assessment or the AmeriGroup or the comprehensive assessment. So that's That's great. It means that we have a captive audience with regards to that process. If you complete assessments, how confident do you feel completing the assessment? Wow. More than half of you said either very confident or sometimes confident and sometimes not. And for some people, they're unsure as to exactly where their confidence and competence lie. So that's great. That's great to know. Question then is, what do you hope to get out of this training? And more than half of you said knowledge. About a quarter of you said skills, and a trickle of you said the resources. So seems like a greater majority of folks want to get knowledge and skills as it relates to completing the assessment process and really getting a better sense as to what's best practices for assessing. So that's great to hear. Thank you once again for sharing that information. Gives me an idea as to where we are in that process. And Patricia says, I do substance use assessment. So in this particular regard, we will look at that as part of the comprehensive assessment process. But that's great to know that in some instances, people work specifically in substance use, and that may be relegated to just doing that single assessment. So when we speak about the assessment process for foundational community supports, we are speaking primarily around the FCS uniformed assessment, that's the MERA group forms that we use, or the comprehensive assessment. So there are two approaches, two standardized way of doing that assessment. And when we speak about the MERA group assessment, we're talking about that assessment that is really aligned with supported housing, and also the supported employment assessment. And those assessments, as we know, are really geared to those specific service lines, those service elements, and are really trying to discern and trying to gather as much information from as much sources as possible to really inform the determination around medical necessity and whether or not that person is really accessing the services that are going to be best for meeting their needs, their most prominent need, and oftentimes the need that they're most committed to working on. So when we speak about the MERA group assessment, we're talking about really trying to discern, determine whether or not someone meets criteria for supported housing, or supported employment, in keeping with the standard criteria for DBHR. Any questions there? Is there any additional information as it relates to the MERA group assessments that I may be missing, that I may not have mentioned, that you think is important to note? And if it's tantamount to what we see across most states, those assessments are very comprehensive. Oftentimes, those who are charged with doing them repeatedly are often providing feedback that sometimes they're cumbersome. As much as comprehensive as they are, they can be cumbersome and a little challenging to complete. And we've also received feedback from consumers that says, I just can't sit in one sitting and complete that entire stuff. It takes hours to do. But as we know, the more information we gather, the more informed we are to make better decisions and work with better collaboration with our consumers. So as much as they can be a little dogged and a little challenging to do, we know the importance of doing them. The comprehensive assessment, on the other hand, is often really provider selected. So different providers may actually do the comprehensive assessment. And we've seen that from the feedback to the polls. And they really they really look carefully at exploration of strengths and needs. What are the strengths that the consumer is bringing to the process, bringing to the table? And what needs do they have? And how they see the service really helping them meet those needs. And Marissa asks, can you resend the PowerPoint for this week's session? I came in a little late. So I'll ask Emily if she can put that in the chat again, but hopefully that helps. So we really look at really the exploration of strengths and needs for that person brings to the table, and how we see the service aligned with meeting those needs specifically. Thank you, Emily. Then we look at what comprehensive assessment does your program use specifically. I know some people spoke specifically to their area of service, like the substance use assessment process. People specifically speak to that. Are there other assessments used by different programs that we may not have been mentioned here? Are there any other unique assessments that are used by your programs that you think it's important to mention? Certainly share that if you find that to be part of your process. Jerry says, we don't do them, but we have gambling assessment. Ah, that's a unique one, certainly. I think I'm assuming that, and I know in some particular states, the comprehensive assessment really have a great deal of categories and may look at certain particular challenges, whether it's functional assessments, whether it's gambling assessments, substance use assessments. Some of them are really integrated in a way that really lends itself to a comprehensive assessment, really looking at all potential areas for needs or challenges. And Kara says, I utilize supplemental assessments. Very good. And that, you may be surprised how it may vary across programs or across specific services, or maybe different particular tools used that may be similar in many regards. Patrick Blum says, for me, it's the one-to-one, face-to-face meeting with each and every one of the consumers, so we know both can know that we can trust, respect, and give dignity to each other. Absolutely. And please do note that as part of the assessment process is not simply a document or a paper. When we speak about the assessment, we're speaking about that entire process of engagement, information sharing, data gathering, and discussion around the person's strengths, needs, vulnerabilities, expectations, dreams, hopes, aspirations. The assessment form is merely a tool in that process. So that's important to note. When I speak about assessment, I'm not speaking entirely about the form, I'm speaking about the process, the form being part of that process. Connie says we run multiple housing programs and may involve FCS as a program source. For most of our program, we use a housing assessment, which may include the SPDAT or TAY, the latter for young adults as part of the coordinated entry. Absolutely. And as we know, particularly with supportive housing, there's a number of different service lines, and they may have different assessments associated with them. But the whole idea is that it's as comprehensive as possible, and it really gathers as much data as possible to make informed decisions about service planning. So when we speak about the AmeriGroup assessment that establishes the medical necessity for FCS, we're really talking about the health needs and risk factors that are associated with eligibility for services. These are the criteria for services in supported housing and supported employment. So even though it may speak generally, it's important to note how AmeriGroup, which is the basic element or the authority that really provides the prior authorization or permission for billing and services, how they really look at the assessment process. So when we speak to the health needs as a criteria for service, we're talking about a number of areas that may be germane to that person's specific condition. So when we speak about the health need, we speak about the need from mental health improvement, stabilization, or prevention. Really looking at whether or not that person needs stabilization, they need to improve management of particular mental health conditions, or they can benefit from preventative service to really abate or prevent them from really becoming more and more functionally challenged by their particular presenting behavioral mental health conditions. We also look at the need for assistance with activities of daily living, whether or not that person's condition may be so impairing that they may need supports to engage in those significant and basic activities of daily living, from managing housing to accessing services to illness management and recovery, really looking at those areas. Or as is mentioned earlier, do they need substance use disorder treatment? Is that person's substance use or misuse condition or challenges so perilous, so challenging that it really impacts their ability to function effectively in the community and sustain housing in the community, housing or employment in the community? So those are the health needs that really lay out the criteria for FCS that is really assessed during that process of the AmeriGroup assessment. And then we look at the risk factors. So it's a combination of health needs and risk factors. And we spoke to that earlier in session 1 as to their specific numbers or specific degree of challenges or degree of needs that really lends itself to how whether or not that person meets medical necessity. So when we speak about the risk factors, we speak to the risk for deterioration of mental illness or substance use, whether or not that person is vulnerable at clear and definable risk of really having more severe challenges related to mental illness or substance use. Whether or not there's dysfunction in role performance. Is there evidence that that person is unable to keep a job for a certain period of time based on a number of variables, or they may be challenging specific roles like parenting or sustaining work, or simply tenancy, really adhering to the guidelines of tenancy, or other such challenges that really impact their daily functioning? And whether or not that person has had frequent or long institutional stays or contacts that really put them at risk or put them in a situation where they haven't learned the skills or haven't mastered the skills of living independently. And I'm glad, Cassie, for giving me a sense as to what the VAT means, the Vulnerability Assessment Tool. So that's, and some of these assessments are very unique to Washington State. So I am learning as I'm training as well. Great information. But this is where we really encapsulate all those concerns or questions that we address in terms of determining medical necessity. And it's important to note, in order for someone to engage in foundational community supports, they need to meet the medical necessity that allows for prior authorization for the services to be provided and billed and reimbursed for. Any questions there? Because it's important to note that Medicaid will only pay for services that are both need and backed up by documentation and the assessment. So even though that person may have that need and you know, unless it is reflected and clearly documented in the assessment process, you then run the risk of not being able to attain authorization to provide that service. So it's important to really gather that information, document that information, and reflect it in the assessment process so that approval can be gained from AmeriGroup to provide the services needed. So in your particular neck of the woods, your particular services, can you tell me what are common health needs or risk factors for FCS clients? What are the most prominent health needs or risk factors that you see in your clientele?
Chronic homelessness.
Chronic homelessness. Absolutely. That is certainly a profound one. And what's even more significant is that criteria, that determination as to what constitutes chronic homelessness can vary from state to state or sometimes county to county. Can you tell me what particular criteria discerns whether someone is considered chronically homeless or just homeless? Is there a distinction?
Well, 12 months of
There you go.
homelessness.
Is that consecutive or cumulative?
Over 3 years.
Over 3 years. And I know I may be drilling you with questions, but that's important to note. And I thank you so much for sharing that. And can that person mute? Thank you. But thank you for sharing that. That's
Hi, Connie. I tried to mute you, but it looks like you unmuted yourself. Thank you.
okay. So my apologies there. But that's great information in terms of what establishes chronic homelessness. So the expectation and the standard is 12 months and over 3 years. That's important to know. That's a significant distinction. And if you don't know that, you certainly can fall prey to not doing your due diligence to ensure that that person's information is shared through the assessment to meet that criteria. So Deborah speaks about chronic homelessness and its impact on clients' mental health, homelessness, mental health, and substance use disorders. So it's a lot of the very familiar ones. Wow, Laurie says, untreated diabetes and high blood pressure. Those metabolic syndrome illnesses, right, that meet that that's significant. And Henry speaks about cumulative. They're okay. Absolutely, yes. Oftentimes, the more you engage with that person, the more you learn about all the challenges or all the chronicity or challenges in that area that the person brings. And Deborah says no income or very low income. Very, very well. And that, I assume that stems from inability to attain or sustain employment. But that's very good information. Thank you for sharing that. But certainly we look at those two criteria in terms of the health need and risk factors that establishes medical necessity. So when we speak about the comprehensive assessment process, we're really, it's more than just simply gathering information that that person is happy to share or willing to share. It's really a concerted, directed process that really helps inform the process of really looking at that person's strengths, that person's need, and really laying the foundation or groundwork for service delivery and how we are going to provide those services in a really concerted, dedicated manner that is intentional and purposeful to meet that person's need. So we really look at exploring past and current experiences and interests. And we try to perform a deeper dive into agreed upon areas with needs. So we really are looking at identifying a person's hopes, dreams, and aspirations. And as we go through this training more, you'll really hear these particular references made more often than not. Because the ultimate concept and principles and values of psychiatric rehabilitation is to really look at that person from their own personhood in terms of that person's hopes, dreams, and aspirations, and how they're aligned with their current needs and efforts to meet those needs. We talk about incorporating a multidimensional wellness focus and really help to identify that person's valued life roles. So we really look at the valued life roles, that person's hopes, dreams, and aspirations, and what are their risks and current needs that could be met by the services we provide, or that may require us expanding our scope of services or connecting that person to additional services to really meet their primary needs. And oftentimes, by completing that kind of assessment, that kind of deep dive, that kind of explorations of past and current experiences and interests, we're trying to identify goals to include on the individualized service plan. So we really look at that process of getting from that engagement to really getting some information that really informs our process of developing an individualized service plan. And ultimately, we need to ensure that we're complete and accurate in our assessment process and our gathering of data and information to inform that process. And Jasmine asks, can you tell us how chronic homelessness is affirmed by MGA or other assessments? What they check for, what documentation can be included to prove the episodes? And that's, once again, and thank you very much for that, Jasmine. I really don't want to assume specifically what that is. I can give you kind of a generalized concept because, as I said, when it comes to assessment for, particularly for homelessness, they can be very, standardized or unique to specific services. But I think the person that spoke earlier spoke to establishing a length of time of homelessness, and it can be cumulative over 3 years. And you ask, what do they check for? Essentially, it may they may look at in terms of, does that person has any evidence, a lease or anything that they established that they had a home or a domicile that they were actually the primary person for, or there's any way of establishing that person's residence or primary residence. And in essence, as times have changed with the COVID pandemic and other such elements, the documentation in terms of what can be included to prove episodes, oftentimes what has been added most recently is even if the person has been couch surfing, even though they may be in a shelter or in a place that is not necessarily on the street, it may still constitute homelessness if it's not a domicile that was primarily paid for or authorized for that person specifically. So there's some specificity that you may have to really speak to. And the best way to do that is to your specific services or supervisory chain to help you determine those specific eligibility criteria. But the assessment process in general really looks at whether or not that person had a domicile or paid place that they live or shared that really establishes residence. So we certainly want to know, the question then is, because we speak specifically about completeness and accuracy of the assessment, why might an assessment be incomplete or inaccurate? Can you think of a concept or a way in which we may be not necessarily the most complete or accurate in an assessment?
Sometimes I feel like the person that I'm doing the assessment on for housing isn't cognitive enough to give me all of the information that I'm asking for at the assessment time.
And thank you. That's a very common element, and it's funny because I have to constantly rein in my enthusiasm around quickly picking up on every word, and that's my own baggage I bring, so bear with me on that. But when we speak to an engagement with the person, I like to use with, because oftentimes when people say, I do the assessment for, and I'm like, oh, no, hold a minute, we do it with. But I get where you're coming from. In most instances, when we look at that, and I think you're certainly accurate, oftentimes people are not the best historians, and that may have varying, it may come from varying places, whether it may be a consequence of substance use or a consequence of the person's mental health condition that they're challenged by. Providing accurate history may be difficult, or the person may have no way of keeping their documentation. So even if they have the best recollection, they don't have documents to support it. But in many instances, yes, we may not get as much information from that person in a face-to-face. That is why we talk about that kind of comprehensive gathering of information from as many sources as possible. I have many instances where people can't remember what hospital they were in, but they know they were in the hospital for a long time. So there are many instances like that. So that's entirely true, and I appreciate that feedback. Connie says some clients are ashamed and don't want to admit to certain things that might provide the eligibility element. Yes. And that's a good observation in that yes, because being homeless and faced with those circumstances really puts people at risk of significant stigma. So oftentimes apprehensiveness and shame may come in terms of sharing information, or maybe a case where that person has shared information with 10 different providers and really didn't feel that they got much out of it. So they're a little apprehensive about doing it the 11th time without some sense of, okay, this is going to be the time and it's going to make a difference. So there are instances where that occurs. But those are definitely very poignant observations. So when we talk about a comprehensive assessment, what are the best practices? What are the standards? What should we be aiming for when we are trying to complete a comprehensive assessment? We want to make sure that it includes all available information. That means not simply or not limited to just that interaction with that person, because as we know, that person may be in many ways compromised in terms of their ability to provide as comprehensive information or accurate information as possible. So we want to make sure that we're getting it from multiple sources and we can cross-check or double-check to ensure accuracy and comprehensiveness of that information. We want to focus on wellness over deficit. There is no greater way of motivating and encouraging and developing trust with someone than really speaking to that person's wellness as opposed to their deficits. Starting that conversation, with that whole idea of seeing that person as a person first. An example, John, I'm glad that you made the effort. I'm glad that you've shown the strength to go through this entire rigmarole that we have here as a system to get to this point of discussing your needs with me. I really appreciate, forthrightness, the honesty, and the bravery you have for doing so. I really want to make sure that I'm helping you in a way that best meets your needs. As opposed to, John, I see you have a long history of homelessness and substance use, and you're coming in for services. I hope you meet the criteria, because if you don't meet the criteria, I can't help you. See the difference in perspective? And it's just words, but they are so powerful in terms of how that is perceived from the person who's receiving the services. So that's important in terms of really looking at it from a wellness perspective as opposed to deficit. Are you going into that engagement focusing on what the person can't do, what they don't have, where they're challenged, or are you looking from the strengths and how do you meet those needs? And Patrick says, of course, those of us who have been in the system can help them with the process and let them know that we really do understand what they're going through on many levels. Absolutely. And I certainly think from that peer perspective, it's actually very helpful and the best. But unfortunately, a number of us may not come from that or have that perspective, but there is a tangible way of doing so in a respectful, meaningful, really, recovery-oriented perspective, wellness-oriented perspective, as opposed to a deficit-oriented perspective. And be strengths-based, identifying unmet needs. So it's that idea of you're here to get housing, as opposed to, I've seen from your history that you've had your own residence before, and life circumstances have hindered you from maintaining that standard. How may I help you get back to that standard if that's your goal? So the idea of helping that person, reminding that person that they've done so before, they've lived in housing before, they have strengths, they have resilience. I am merely a bridge to getting them back to where they need to be or where they want to be. It's just as critical as everything that you do subsequently. Because as we know, we have a limited opportunity to build trust in the early phases. And if we don't build that trust, it is very difficult to be collaborative and to really work together in a meaningful, respectful way. So those are important elements of best practices that we need to adhere to, we need to be conscious of, and we need to be using to drive our engagement at all levels of the process. So in terms of best practice, include all available information. Client self-report, staff observation, Amerigroup assessment, referral and intake information. It is best when that data is really collected in a tangible, comprehensive way, and they used collectively to really create a picture of that person's life experience, skills, knowledge, resources, strengths, hopes, dreams, and aspiration, and really help us to move towards developing a service plan. And great, Deborah says, I've stated to the client that I'm not here to judge, I'm here to help them change their circumstances and work with them to get their needs met. Absolutely. That respect is profound, that respect is salient, that respect is the difference between you helping that person or that person seeing you merely as an obstacle to their movement. And from these, what is the most helpful source of information for you? I think for different people, it may be different. Is the Amerigroup assessment the most helpful, or is it altogether most helpful? Or, some people have mentioned the staff observation or the client report as being more a driver for their assessment. But you need to know in your own concept what works best for you and whether or not you need to make some changes or expand beyond what is available to you. Sure, Henry, we'll have those slides posted again. So when we talk about the self-report, because oftentimes that's the commencement point, that's the starter, we want to make sure that we are really looking at it from that perspective. We want to make sure that we're aware that we can't ask too many close-ended questions. That tends to, promote shutdown with the consumer, or they feel like they're being interrogated as opposed to really having a discourse. So we want to make sure that we don't use too many close-ended questions because they tend to limit response choices. And if you ask questions like, what is your income source? Where do you live? You want more than that. And these are oftentimes common in the Amerigroup assessment, but you can certainly expand beyond that by gathering information from multiple sources. So you're coming to the table informed. There's no greater benefit than when the client feels that you have taken the time to research their circumstance and you're coming there informed. You're not treating them like another number or another person to pass the time with, but you've taken your time to do some research. So you come informed. You know the person's name. You have a concept as to where they are, where they live, where they lived, what they've done, whether they're a veteran or not, what are some of the unique elements of their lives. Critical and important information. So the idea here, the guidance is to start with open-ended questions. Open the conversation with, tell me about, what has been your experience? What has been some of the positive experiences you've had? I know in one instance, it took me by surprise when I was actually sharing an assessment with someone and they asked someone who had a history of homelessness, would you care to share or tell me more about some of the strengths that you've gained from surviving homelessness. Tell me about some of the unique talents you've gained from being on the streets. I was taken aback because I never thought that was going to be part of an assessment process, but I realized how much that was an engagement hook, how much that person really admired the fact that you saw even their most significant struggle as an opportunity for growth and resilience. Tell me about your last work experience, as opposed to have you worked before, because the person can say yes or no, and that's it, close off. So those are some of the best practices in the comprehensive assessment. Really looking at open-ended questions and really engaging that person in a discourse. And I like that, Patrick. Don't forget to try and use humor and positivity in your engagement with the client. As I think certainly humor is a great tool. It has to be timely, it has to be respectful, and you have had to develop some level of trust, because as much as humor can be a great tool, it can also be a damaging element if you use it inappropriately, or what you think is humor does not come across as humor. Curiosity is certainly a significant one. Give the person a sense that you really want to get to know them. So let's take this quick opportunity. I want to really jump into looking at that wellness perspective. And bear with me one moment. But I want to share this video with you and you can give me your feedback.
Earl, we don't have sound.
Oh, my apology. Let me make sure that I share the sound. So if you don't mind, I'd like to start again.
The Substance Abuse and Mental Health Services Administration, or SAMHSA, created the Wellness Initiative to help people with mental and/or substance use disorders, and all people, live longer, healthier lives by focusing on the 8 dimensions of wellness that connect all aspects of behavioral health. Improving wellness by taking action on each of these dimensions addresses early mortality from treatable and preventable conditions. Embracing wellness is about life and living and becoming the healthiest you possible. Listen to your feelings, express them to people you trust, and maintain a positive outlook. Make it a point to understand your finances, establish good financial habits, and plan for the future. A sense of belonging and a reliable support system help during difficult times. Make at least one social connection daily. Seek advice from peers or support groups. And create healthy friendships. Enhancing your connection to self, nature, and others brings balance and peace to your life. Take time to discover what values and beliefs are most important to you. Look for satisfaction from things you're passionate about, whether it is through work, school, or volunteering. Reduce your risk of many illnesses by increasing activity levels according to your abilities, getting restful sleep at night, choosing healthy foods, and exploring outdoors to reduce stress and increase energy levels. Be a lifelong learner by expanding your knowledge and finding creative outlets that stimulate your mind and sense of curiosity. Be open to new ideas, insights, and wisdom. A positive environment has a calming effect. Find surroundings that encourage good physical and mental health, and where you also feel safe. At SAMHSA, we envision a future in which people with mental and/or substance use disorders, and all people, pursue optimal health, happiness, recovery, and a full and satisfying life in the community. Wellness is an ongoing pursuit and can be challenging at times, but striving to make small daily improvements is the key to success. For more information and resources about wellness,
So certainly the idea of looking at things from through a wellness lens and a wellness perspective is paramount and significant to providing service aligned with the philosophies and concept of psychiatric rehabilitation. And it's important. We want to make sure that that's the perspective that you're using, or at least striving for. And in that sense, we really looked at the 8 dimensions of wellness. And my question to you is, how familiar are you with the 8 dimensions of wellness? And you certainly can provide some feedback in the chat by simply saying how familiar you are. And if you're familiar, how comfortable are you with understanding those dimensions? Patrick says very familiar, very similar to the 8 intelligences, former teacher. Yes, and they're aligned with a number of other elements, but the 8 dimensions of wellness is so specific to psychiatric rehabilitation. It's critical and important to do that. And Shannon says, comfortable and very familiar. Kathy says, oh, I understand them. It's putting them all in practice. My personal life is not always easy. Absolutely. And that's a level of humility that we need to bring to our engagement with consumers, to speak to our own authenticity by certainly speaking to some of our own challenges, or even being more cognizant and compassionate that it is challenging to address those 8 dimensions altogether. But I'm glad that people are familiar with those 8 dimensions, because they really speak to what we should do and the concept to which we drive most of our engagement. So I want to quickly do some practice, if possible, to really see how we can make that wellness concept more of a familiar practice for us. So the question then is, and I want to make sure that I'm keeping up with the chat. And Cassie says, where does mental health fall into these dimensions? Certainly in the emotional dimension. We speak to, managing our mental illness, our whole sense of wellness, but certainly it falls into the emotional dimension. So what is an area of wellness? And I want to ask you that question. So I'm going to ask you, what area of wellness, what dimension of wellness does these particular concerns fall into? Transportation concerns during social distancing. What would you say? What dimension would that particular challenge fall into? Interesting. Environmental, physical, financial, social, financial. So that's another element that's important to note, that sometimes particular challenges or needs can fall into multiple dimensions. Because when we talk about transportation, we certainly are speaking to a financial element, we're talking about an environmental element, we're certainly talking about potentially occupational in order for us to have the finances to do so. So there's lots of, and that's Patrick, you're spot on, multiple areas, social, financial, occupational. In some regards, if it's public transit and you have to deal with what you have to deal with on the train or the bus, it may be emotional in terms of dealing with the elements related to making the most of that. A good example, and I always ask this, is where do you think hoarding and stockpiling, what dimensions of a consumer's life that may fall into? Hoarding and stockpiling possessions. Interesting. First is emotional. And Jose said all, yes. Financial, yes, oftentimes, even though some people who may not necessarily impact their finances. They may be hoarding, things that they just pick up off the streets and so forth, but lots of areas: emotional, financial, physical, social, spiritual. Interesting. Absolutely, because that's kind of a challenge that really has a vast and expansive impact on a person's life. Jessica says all areas, so it may certainly address all of the dimensions of wellness. So that's important to note, that oftentimes challenges and needs don't necessarily fall into a single dimension. It may impact multiple dimensions. And even if it's really significant to one, that emotional response or how that person deal with it may impact other dimensions of wellness. So that's important to be aware of when engaging with people around wellness. So it's important to know that wellness is interdependent. So, and we look at some examples in terms of how it may impact specific needs, specific challenges. And what we learned certainly from your responses is that it may impact multiple dimensions, or it may be impacted by multiple dimensions. So it's really interdependent in that way. So best practice number 3, certainly we've looked at the 2 others, is really to be strength-based in identifying unmet needs. What are the unmet needs that that person is bringing to the table, that that person is hampered by or hindered by? Is it housing and employment? Is it ADLs in areas of wellness related to housing and employment? What are some of the common unmet needs that we see in our clientele in supported housing as well as supported employment? And what's important is, in any area of need, focus on strengths from relevant experiences, from existing knowledge, skills, or resources. So we spoke about that earlier in terms of, even though you have a sense as to where this person may have identified their biggest areas of need, you want to engage with that person around what have been their experiences related to that. Both recent experience, past experience, or even experience of people that they know, loved ones that they may have, that may be informing their behavior, informing their thoughts, informing their feelings around that area of need. And what knowledge, skills, and resources they have or need in order to make the best effort to meet the goals that they've identified, or the goals that they want to achieve. So those are important elements. And I want to quickly do a little practice. So we want to look at the case. We want to assess Angela. Now, Angela is a 27-year-old Chinese-American woman born and still living in Seattle. She has a diagnosis of bipolar 1 disorder with delusions. She's lived in the community for the last 3 years with a few short-term hospitalizations. Recently, her primary care informed her she is pre-diabetic, which concerns her since she has relatives with diabetes. She reports when she isn't working, she often sits at home watching TV and eating junk food. The team observes she doesn't cook or have access to healthy food options, partially because she lives close to delis. She lives in a food desert. There are no supermarkets within walking distance. She reports she always has enough to eat through SNAP and a food pantry. Now, what is an unmet need for Angela, in your opinion? Oh, Flora says support with ADLs. That is interesting. Is there a specific ADL activity that she needs the most support with? Laurie says possible transportation. Steph says learning, social supports. And transportation and access to a good nutritionist, Deborah Wingfield says. Those are could be lofty. It's very difficult to find a good nutritionist, but certainly getting some nutritional advice can be helpful. But transportation certainly speaks to that. Kathy says, social, no indication of friends. And Kathy, I like that idea, but that's where we speak to really expanding the assessment and really getting as much information as possible, because it may not be indicating that she has friends in that description, but we don't know. We need to explore that. No indication of activity, environmental, lack of healthy food options. Access to a group with others who have diabetes. Now that can be helpful in terms of support if Angela identifies social support or specific support to illness management is going to be helpful to us, for her. Because in some instances, simply putting that person in a support group does not necessarily help them automatically. They have to be committed, ready, and see it as helpful. But those are great observations. So we talk about transportation, potentially some assistance with ADLs, social support, presumably, and some other areas of need. How about health information? Illness management. Is she, even though she's aware of her prediabetes status and aware that she may be predisposed to diabetes, is she informed enough to make good decisions that really speak to managing the condition or preventing that diabetes? Nutrition lessons, says Veronica. It may start with simply asking her, you know, what is her history in terms of nutrition? What if Angela's always eaten fast food and that's the only thing she knows and that's all she's interested in eating? Can we look at healthier fast food options as opposed to, you know, drastically trying to inform her as to all the things that she may not be ready to address in terms of really looking at healthy eating? So I agree with Connie, while good nutrition advice may be helpful, without access to healthy food options, it would be frustrating for her or anything else. Absolutely. So recognizing that she may be in a food desert and are there supports that can help her through that process, or how does she access that? Is there a way to getting shared transportation? Is there transportation supports? You know, is there a food bank is there a farmer's market that she may be able to access? Those kinds of elements, certainly. So what is a related strength that Angela brings to the table? And what is a potential goal for Angela?
She's remained living in the community through all of her hospitalizations.
Absolutely, spot on. That's a great observation. She is certainly, you know, managing in the community despite the challenge. Absolutely. And what would be a goal? And Shri says she has a connection with her primary care provider. Absolutely. And Patrick asks again, how close is she working with her local center for independent living? It may be, does she know of that center? Are there good community options going to assist her with bus passes so she can visit? Is she aware that those services are available? So those may certainly be the question. What may be a goal for Angela? If you have to write a goal with Angela's support and help and the knowledge that you've gained from this particular description, what would be a goal? What would be a tentative goal? What would be a speculative goal? And Patrick says, identify community resources that can, correct. So identify some community resources that may be, you know, helpful in terms of providing her with specific resources that she may need. Henry says, learn about what steps to treat prediabetes. Yes, is pre-diabetes, you know, do you have to engage in treatment? Do you have to get more information? What can help you stave off potential diabetes, given the predisposition and the challenges? Deborah says a goal could be to learn more about support groups who can help her learn more about living with diabetes. Yeah, that may be, you know, an interim goal. Help organize triggers, recognize triggers which cause her previous hospitalization to help reduce inpatient care. A number of, yes. So we certainly have to work with Angela to determine what's not just important, but what she is really focused on working on, what's a priority item for her, where her confidence lie, you know, what knowledge, skills, and resource she may need to begin that process of goal attainment or goal recognition. But those great responses. Thank you very much. So normally we'll take a quick break here, but I want to know if people are interested in taking a 2 or 3 minutes break, or you want to just keep trucking on until we get to the end.
Yes.
I don't want to. So yes, when you say yes, what does that mean? I'm gonna maybe I just ask too much of a close-ended question, right? I should have asked an open-ended question. So someone says break, please, break, please, break, please, break. Okay, so let's take a break. We will get back at 1:53. So you take 3 minutes and we'll get back at 1:53. Okay, we'll see you back at 1:53. Okay, well, welcome back. I know it was a very short break, but I wanted to do the honor of adhering to the break. I know folks asked for a break in the first speaks evaluation. We want to demonstrate that we're being responsive. Just understanding it's difficult to stick with it for 2 hours, you know, straight through. So appreciate the feedback. So let's move right along. So we look at the assessment tool and we talk about that multi-dimension wellness worksheet. So we're looking from the frame of reference of wellness, and we want to ensure that we're utilizing all the tools applicable to staying focused on wellness. And I'm going to ask Emily to share the wellness worksheet that we use here in New Jersey. We've asked people that they can certainly use as a template. And we really look at the wellness worksheet. And when we do so, we really look at areas of wellness, and we speak to certain particular questions that we may ask to inform that process. So we look at, for each dimension, we ask the person to choose a value of 1 to 5 to indicate where they are now in a particular dimension, and a value of 1 to 5 for where they would like to be. So we have that concept of 1 to 5, 1 being certainly the least, you know, confident or competent or the least progressed, and 5 being certainly the most, where they would like to be. So that's important to kind of get that sense of that Likert scale from 1 to 5. We explore what the current score means to them. So if that person says, I'm at a 1 or at a 2 with regards to my goal aspirations or the aspirations for that goal, you really want to get a sense as to what does that mean? That particular score, what does it mean? And what could be done to improve that score if they want to? In areas they want to improve, ask them to identify a goal. So the person says, you know, when it comes to me working on attaining an apartment of my own, you know, I'm around a 2, but I would like to be at a 4, you know, in the next 6 months. So you really ask that person, what does 2 means to you? 2 means that, you know I want that home or apartment, but I don't know that I'm ready to handle the responsibilities yet. And I think I need to really get a better grip of what it means to live in an apartment, like paying rent and financial management and all those things. I want to learn those particular skills. After reviewing each dimension, help the person identify the top 2 or 3 priority dimensions, an area where they would like to make a change, and use the last column to check them off. So if you go to that wellness worksheet, you'll see those elements established there. So we talk about how do we use that worksheet to help that person really address challenges or needs in those areas. Okay, so when we use the wellness worksheet, and we've talked about, you know, using it for different dimensions of wellness, we want to make sure that we're asking what is an unmet need, what is the strength, what is the potential goal. So you really want to establish with that person an idea as to what's an unmet need. Are they recognizing that there's a need that they desire but hasn't been met? What is the strength they bring to that particular need area, and what is a potential goal for them to work on meeting that need? So we want to quickly, and we'll do that in the next few minutes, we want to ensure that we get a practice opportunity. So I want to put folks in a breakout group. So you will have one person identified as a counselor and one person will be there as a participant. We ask that that person who is serving in the role of a participant be authentic. The counselor will ask the participant about one area of wellness using the wellness worksheet. And it's important that when you're go through that process, we want you to bring back unmet need, a strength, and a potential goal. And if there's time, you can switch roles. So this is really a practice opportunity that we hope to help you practice that. Yes. Hi, Emily.
Hi, everybody. So I just want to clarify, I've been indicating in the chat box with the timing issue. So I understand that the Zoom invite was for an hour and a half. Unfortunately, there was an error in the timing when the Zoom invite was set up. However, the training was advertised as being a 2-hour training through Washington DBHR. And when you registered through the Zoom link, the information provided also indicated it was a 2-hour meeting. So I'm sorry for the discrepancy in the calendar invite, but the session last week was 2 hours. And the session this week is also going to be 2 hours. And moving forward, all of the sessions are going to be 2 hours. So if you have to hop off, that's fine. You don't have to let us know. We understand if you only plan for the meeting to be an hour and a half. But moving forward, all of the sessions are going to be 2 hours. I just wanted to clarify that for a second.
Thank you, Emily. That certainly has been a challenge in terms of the setup of the stuff. So we're hoping that you're able to do that. And we'll work on our end to see if we can actually have those that information modified, but it's kind of down the road, right?
No, it was modified. So if you request a new link, so if you go in and kind of like re-register for the training, the new link will indicate that it's 2 hours. So it was fixed.
Correct. Absolutely. Thank you for clarifying that. So if we can, we want to break people out into a breakout group and use this particular guideline for really managing that breakout activity. And I know some people may not be able to engage in the breakout group, but you certainly can try to pose a question in the chat that you may be able to respond to. So I'm going to put people in a breakout group for about 5 minutes, and you can certainly use that wellness worksheet to ask the question, to address those concerns. You want to make sure that someone is serving in the role of a counselor and the other person is a participant, and you're really using that wellness worksheet to address a particular dimension. And you ask the question about an area of wellness using that worksheet. We want to talk about unmet need, a strength, and a potential goal, and we hope that someone can bring back some information to help in the discussion. And I understand a lot of people may not, some people may not be able to engage in the particular breakout group, but we want to give people who can an opportunity to practice. So we'll be put in breakout groups and you'll have 5 minutes. At the 3-minute mark, I'll give you a heads up that you can swap roles if you have the time. Or a matter of fact, I'll give people 6 minutes and we can swap at the 3-minute mark. So please let me know if you see the breakout group. And please make sure that you join. And once again, I certainly understand that not everyone may be able to join the breakout group. That's fine. What I would ask folks who haven't joined the breakout group is think of a consumer that you are currently providing services to. And, you know, think of yourself engaging with them, asking them questions as to, let's say, the financial wellness, the financial dimension. And think of what's an unmet need for that consumer, what's the strength that they bring, and what may be a potential goal for that consumer that you've put in your crosshairs. Think of that and certainly share that information in the chat with me if you can. So once again, we're talking about a consumer that you're working with who has challenges in the financial dimension. And from your knowledge of that person, I want to know what you think is an unmet need, what's the strength, and what's a potential goal for that person in that particular dimension. So take a shot at it. And certainly provide your feedback in the chat if you can. Oh, I'm sorry, Patricia. If you can't, they can't see you here, you can certainly serve as the observer in that breakout group. So I don't know what group you were in, Patricia. Can you tell me what group you were in so I can put you back, but you can serve as the observer? Your group with Audrey. Okay. Hi, Patricia, what I'm going to ask you to do is I asked the folks who were unable to get into the breakout group to think of a client that they have and think of the financial dimension and think of what you know of that person, what may be an unmet need for them, what may be a strength, and what may be a goal for that person. And post that information in the chat. We'll certainly share that. And Patricia says they need Medicaid and they have no food stamps, and a goal would be to access those resources. Okay. And Patricia, what strengths does that person bring to the process? What strengths do they have? Well, Patricia says he's on MET and is unable to go to appointments, but he is willing. Very good. So he has that sense of willingness and desire. Great. Thanks for sharing. Angela speaks to get a job when discharging from the hospital. And once again, the question is, what strength does that person bring to the table? Have to, account for that strength or strengths or resilience that that person brings to the process. I'm going to bring back the folks from the breakout group so we can have a discourse and get some feedback from them. So Jessica speaks, the financial realm person is unhoused, looking for employment and does not have a valid ID or transportation. Participant is motivated to find stable housing and employment. Goal would be to obtain ID and seek employment through temp employment to obtain HEN voucher from DHS. Absolutely, that's fantastic. Great job of articulating that. that was a well done process, Jessica. I really appreciate it. Thank you. So as we await the people coming back from the breakout group,
Is being recorded.
Oh, I'm so loud. Oops. Sorry.
I know typically when you come back, you'll be unmuted. So if you can mute, but I certainly would love to hear some feedback from folks who were part of the breakout group. How did things go? Were you able to get that process done? And what were some unmet needs, strengths, and potential goals for the consumers, for the person that you would discuss that challenge with? And you can certainly unmute if you choose to do so and give me some feedback, or you can share it in the chat. So Brandy says unmet needs, struggling with depression. And
In our
what,
group,
go ahead.
oh, I'm sorry. In our group, we also talked about the unmet need of depression.
Okay. When you talk about the unmet need of depression, what would the need being met look like? What is it the person is striving for? Given that depression is a chronic condition, what is it they want? Where do they want to be that they're not?
Hi, I'm
Go ahead,
Brandy.
Miss Brandy.
Our discussion was someone who is struggling with the symptoms of depression, but hasn't been able to get into counseling and hasn't
Okay.
been able to deal with the underlying causes of that depression, whether it be past traumas, chemical imbalance, PTSDs, you know, whatever those diagnoses are, but getting them a diagnosis and getting them some medication and some help so that maybe they don't feel like they're stuck in the same place and they can move forward.
Fantastic. So you're speaking to that person striving to get to a place where they're better able to manage their condition so
Yes.
that they can actually do the things they want to do in their lives, right?
Exactly.
That's fantastic. And what's the strength? You talk about the person having that desire. Is that desire and willingness the strength that they bring?
Yes, and one of the strengths that we came up with for this person was that they're self-advocating, that
fantastic.
they're able to say, hey, I'm dealing with this depression. It's gotten to a point I need help. And they're able to reach out and say that they need help, because as we know, a lot of people struggling with depression can't do that.
Absolutely.
Especially when they're in the midst of it and they just feel like they live in quicksand. So self-advocating is definitely a big strength for our clients.
Thank you so much for sharing there, Brandy. And you hit it right on the head. Person's
Thank you.
awareness that they're, you know, things are not where they want it to be. They know they can do better. They want to do better. They want to manage their lives better. And they're advocating for themselves to getting the necessary services they need to acquire that skill. So that's great. Thank you. Henry says, had fun being the person answering. I was coming up with an action plan for myself as we talk. And that's often the case, where sometimes when you're sitting in that seat, it can really lend itself to you really having some introspection and really coming up with your own processes to help you move in a more positive direction. Flora says, seeking counseling. So that was great. That's great. So I'm glad that you were able to share. Nikki says, client needs pre-diabetic and wants to lose weight, strength, identifies own health need, goal, purchase a bike to improve health. That's great. And thank you so much for that journey. I know sometimes getting into breaking and having that discussion can be challenging, but it also lends itself to you really feeling a sense of understanding as to what it's like when that person is sitting in that seat and you're engaging with them. So you have some compassion and understanding as to how challenging it can be to not just discuss your challenges and concern, but actually, you know, have the need to actually explore your own unmet needs, you know, what strengths you bring and what goal you potentially want to achieve. So that's great. Glad that you were able to engage in that. So we speak to prioritizing goals for assessment, because once we get that assessment, get that information, and we begin to really process around delving into what identified goals that we want to formulate and we want to put into to articulate and to document, we want to make sure that the goals are developed based on hopes, dreams, and aspirations, needed skills and resources. So we are not prescribing a goal for that person, but actually soliciting, discussing, exploring that person's hopes, dreams, and aspirations to help them arrive at a goal that is important, is valid, and is also something they're motivated to work on. And that's critical. And the goals need to be supported by motivation from valued life roles. As Brandy alluded to, that person recognizing that their depression was really hindering their actual basic and important life functions. And therefore, they saw being a healthy person, a functioning person, a person who's living meaningfully and full as a valued life role. And they wanted to have that materialize. And the strengths of that client skills and resources in that area, and as Brandy spoke to, that person's recognition of the challenges they face, the awareness that they're not where they need to be, as well as having a full sense of they can advocate for themselves and speak on their own behalf as being those strengths that they bring. And what do they need? More information about specific things, access to specific resources, skills around articulating, advocating, engaging, and possibly changing behaviors to better function in their specific environment. An assessment is the basis for individualized service plans, the development of those. We talk about identifying the skills and resources or knowledge that that person needs, and that's what we formulate and integrate into an identified service, an individualized service plan. So when we talk about prioritizing goals from the assessment, we're talking about really taking that information and putting it into the goal formulation process using these particular guidelines. Really focusing on hope, dreams, and aspirations, needed skills and resources, motivation for valued life roles, strengths that the person brings, and resources in that area. And that's how we really take that information, what knowledge that person needs to help them get to their goal, what skills they need to get to their goals. So we have knowledge, skills, and what resources they need to access to get to those goals. So when we speak about goal development, we're talking about really developing or formulating those goals from the KSRs, the knowledge, skills, and resources that are unmet, that needs to be met, that needs to be achieved, that needs to be fortified, that need to be enhanced. Those are the things that we talk about when we talk about goal formulation. Any questions there? How do we get from the assessment to the goal development? So we also have to be aware that there are challenges to assessment. It's not a easily fleshed out process. It's not always smoothly operated process. There's specific challenges. Sometimes, as was mentioned earlier, the client may have challenges with sharing information, whether it's through shame, whether it's particular functional challenges that prevent that person from being a good historian or providing comprehensive information. The person may be tired of being asked, what goal do you want to work on? It may have been overwhelming. The person may have done this a million times and may not have gotten the results that they thought they would, and therefore they're a little apprehensive about doing so again. And oftentimes discussing goals can trigger feelings of disappointment, anger, frustration, or sadness. Whatever that person's experiences may have been with prior service engagement, you don't know unless you explore. And that may be, you know, in many ways, stymieing their willingness or engagement with you. And unless you explore that, you may not be aware as to why is this person not moving it progressively towards their goals. So you have to be aware of the challenges that may come with the assessment process. What's important tip is to follow the client's lead. You know, see where they start that conversation or engagement and really take it from there. Focus on areas of interest, change, or progress. So sometimes instead of saying, well, I see you have diabetes, so I automatically assume that you may need nutritional support. You want to focus on where that person is. Take the person's lead. How are all the challenges in your life affecting you? Tell me more about that. And can you be more specific in terms of, are there medical concerns? Are there psychiatric concerns? Are there, you know, environmental concerns? Really explore those dimensions. What questions or strategies have been helpful for you in terms of those assessment processes? I'd like to certainly know. And in the interest of time, I'm going to push quickly to get some feedback from you. But tell me, in your experience, what are some of the questions that have been helpful? Or strategies that have been helpful to start an assessment? What has worked? I know for a number of us, we have that, we call it that question that really has worked phenomenally for us in the past or recently, and we tend to you know, hold on to that. We tend to use that specifically. But think of that for a moment while we really look at really understanding the importance of the knowledge, skills, and resources as a prelude to goal development. So we really look at that comprehensive assessment that should lead to goal identification. The knowledge, skills, and resources really are identified to achieve the goal. What does it the person need? What knowledge they need? What skills they need to learn? What resources they need to access in order to meet their goals? And how do we import that and formulate that in the service plan? And how do they move from the goals to objectives and then interventions? So really breaking that down into those steps. And those are the critical elements as to how assessment informs the service plan that then informs the services. Fantastic, Laurie. Laurie says, where would you like to be in 6 months? Let's explore ways to accomplish this. Helps people focus sometimes. Yes, really. That overview, that global concept. Because oftentimes you have to be careful not to lead that person by looking at where the deficits are focused and then just focusing on that. That person may have aspirations beyond that. And just be aware that oftentimes consumers, in many cases, are so accustomed to just responding to what you ask that they may be led without even being conscious that you're leading them. So you have to open that global discussion first. So as we want to wrap up, I want to make sure that we have met the objectives of today. You were able to look at you know, a major part of what the assessment is like, what constitute best practices in the assessment process, and what are some of the challenges to the assessment. Hoping that you have some understanding as to those elements. Emily's put the evaluation in the chat. I ask that you take a few minutes to respond to the evaluation. It informs how we do this training. What is the best way for us to relay the information, to share the critical elements of this training with you, and how can we continually evolve in terms of making sure the training is really responsive to your needs, and whether or not, you know, how we're doing it is working very well. We want to know, and we really appreciate your feedback. So if you can take a minute or two, complete the evaluation. And I appreciate it, Karis. We certainly will do our best to add a break in. We've gotten that feedback from the evaluations, and we want to make sure we're responsive. We hope that we can continue to keep the break as part of the process. But if you can, certainly let me know by giving a thumbs up or a yes if in your opinion we have met the objectives for today's training. Fantastic. Getting those yeses. Want to make sure that we spoke specifically and comprehensively to the assessment process, to what are the best practices for assessment, and what are some of the challenges to the assessment process, and the focus in terms of the wellness focus and, trying not to be deficit oriented, really focusing on those principles of psychiatric rehabilitation to inform the assessment process, so that we set a good groundwork and a good precedent for engaging in service. I appreciate it. Thank you all so much for your engagement and your feedback. This was as engaging as I would like it to be, and I hope that you were able to derive a lot of information and guidance and certainly knowledge from this engagement. Look forward to seeing you next week. Absolutely. So thank you all. We have a few minutes. Quickly, the Golden Thread of FCS number 3 is going to be held next Monday at the same time. Please note that it's from 12:30 to 2:30 your time. So it's really 2 hours, and please ignore the initial link that said an hour and a half. It's 2 hours, and please, if you can, accommodate that time. It's going to be focused on individualized service plan components and goal development, and it's going to be facilitated by my colleague Emily Bands, and I'm going to be there in support as well. And the learning application, we ask if you can for next week, try using the wellness worksheet with a client, and after you reflect on that use, we want to know what you learned from using it, and do you have questions or concerns, and we'll address those next Monday. So if there's any questions, comments, or concerns, we have 2 minutes to kind of provide as much feedback as we can. Once again, I apologize. Yes, Stephanie, I meant 9:30 to 11:30. I'm going to have to get myself into the Washington time zone focus. So yes, that's why I think I should simply say the same time as last week. And thank you so much. Yes, Emily, let's stop the recording.